My paper was on dementia end-of-life pain management. Literature review was performed to evaluate the most effective evidence-based research, interventions, and tools used in assessing, monitoring, and controlling pain in the final stages of Alzheimer's dementia. The subject was chosen because my skilled nursing facility was inconsistent with pain management of our Alzheimer's dementia patients in their final year, and especially the final months of life, where protocols really need to be implemented. The significance. The Alzheimer's Disease International's World Alzheimer's Report 2010 reported that the Alzheimer's dementia population of 36 million would exceed an alarming 115 million people across the world by year 2050. Research also indicates that in the last year of life, pain management for Alzheimer's patients is the most undertreated end-of-life condition, especially in the last few weeks or months, due to their decreasing cognitive responses and abilities. Additionally, residents with dementia that spend their final days in care facilities are estimated at 75%, to which the total prevalence of pain was found to be from 50 to 80%. The journal I selected was the Journal of Advanced Nursing, otherwise known as JAN. It's a monthly international peer-reviewed scientific journal. JAN contributes to the advancements of evidence-based nursing, midwifery, and healthcare by disseminating high-quality research and scholarship of contemporary relevance and with potential to advance knowledge for practice, education, management, or policy. Why it was chosen, it's a world-leading international peer-reviewed journal. It's the most read nursing journal in the world. Over 3 million articles downloaded online per year and accessible in over 10,000 libraries worldwide, including over 3,500 in developing countries with free or low-cost access. It addresses elderly care in long-term facilities. There are many articles published for this population. There is also fast and easy online submission, and the journal impact factor has journal impact factor of 1.685. My search process, databases used were Sinal Complete, Joanna Briggs Institute, Evidence-Based Practice, and Scopus. Keywords used were end-of-life, palliative care, palliative medication, dementia, and pain. Yielded a total of 38,428 articles. The original search of the Sinal database using keywords produced a total of 37,052 papers. From the Joanna Briggs Institute, the database was a total of 7 articles were produced, and for Scopus, 1,369 papers were retrieved. The inclusion criteria was Alzheimer's dementia, end-of-life pain management. Limitations were English, and then 2008 to present. And the final yielded 8 articles. They met the final criteria that were included in the literature review. This is a sample of my evaluation table. Shows an article from the journal Pain Management Nursing. This was a qualitative study of 7 nurses with varied experiences, some in years and some in the specialties. And it's all at one hospital, and it gets their feedback and opinions on the end-of-life pain management and some things that they feel need to be addressed. It pretty much answers a lot of, or brings up a lot of questions that we all, it crosses our minds, or what we'd like to be answered also. In conclusion, the evidence is suggestive of behavior assessment tools in the early and moderate stages of Alzheimer's dementia. Cognitive assessment tools additionally are needed to monitor the progression of the disease. In the severe stages of dementia, evidence-based research shows scheduled pain medications to be the most effective for this group due to a lack of sensory and motor responses for accurate assessment. Although there are various combinations of observational, behavioral, and pain assessments and tools, there is a dire need for a standardized assessment for this frail population of the cognitively impaired. Further studies are needed to determine a gold standard for pain management of the Alzheimer's patient. The nursing implications for practice would need to start with education and training. The education of the clinical manifestations and progression of pain in patients with dementia is important in understanding the physiological pathways of this disease and the behavioral and pain assessment tools needed to pinpoint the progression of Alzheimer's dementia. The implementation of adequate assessment tools for behavior and cognitive functions that should at least include the MDS tool, otherwise known as the minimum data set, a CPS tool, which is a cognitive performance scale, and the DBS tool, which is a discomfort behavioral scale. This is for baseline assessment and progression of the disease. The assessment tools used to identify the progression of Alzheimer's dementia should indicate when scheduled pain medication should be implemented. An assessment of pain in the early stages is an indication that there will continue to be pain in the final stages. Thank you very much.